Ocular trauma is any kind of ocular injury, and it can range from just mild impact on the eye to severe, injury and severe affection to the eye. The symptoms of ocular trauma can range from very mild symptoms to very severe symptoms. So the patient can come with watery eye, it can come with pain in the eye, or comes with blurred vision, or in severe cases he comes or she comes with loss of the vision. So the trauma can be very mild, just minimal impact on the eye, causing either like swelling or bleeding around the eye or in the front coats of the eye, or causing bleeding, more severe cases causing bleeding inside the eye and having serious impact on the vision. And so it depends really on the severity and the kind and the type of the trauma, and also whether the causative agent of the trauma is a blunt object or a sharp object. Blunt object, can cause very mild impact on the front layers of the eye. However, penetrating injury may cause more serious injury, causing a cut or in the one of the layers of the eye, or cause an ulcer of the eye. And in severe cases, the sharp object may penetrate and be lodged inside the eye, causing more serious injury inside the eye, like a tear in the retina, which is inside coat of the eye, is just like the film in the back of the camera, and this cuts in the retina can lead to retinal detachment in severe cases. This condition can be either mild or could be very serious. And this will depend on the impacting factors and the severity and the strength of the trauma. So if the trauma is very severe and high impact, like a high impact, high speed foreign body that touch the eye will manage to get inside the eye, the trauma will be severe, causing injury to the front coats of the eye, the front window of the eye, may cause injury to the lens as well, causing a cataract, may cause also bleeding inside the eye, or cuts and tear in the retina. And the symptom will depend on the severity of this trauma. So the patient may lose the vision immediately if the trauma is very severe. If the patient sustained any kind of ocular trauma, I would recommend that the patient seeks prompt medical advice, even if the trauma is mild, because for any trauma, we would like to examine the eye, look if there is any impact of such like type of trauma. Has it caused any injury, either external or internal? Does this injury needs a treatment? And even if the trauma is very mild and causes just a scratch, it will be managed with a medical treatment. But it's better to be started early, because we need to examine the front surface of the eye. Also, we need to examine the back part of the eye to make sure that we cover all parts of the eye, and we manage if any impact of such trauma. Ocular trauma treatment, it depends on the type of the injury sustained in the eye, and also depends on the kind of the traumatic agent. So if it's caused by blunt objects, which may cause like a black eye or bleeding in the front, it may not need any treatment, just conservative treatment. However, if the trauma causing like a scratch or ulcer in one of the coats of the eye, we may need to start the patient on antibiotic eye drops and other pain relieving either agents, tablets, for sometimes until this ulcer or abrasion heals. If the trauma is very severe, causing more damage to the inside of the eye, we may, in some cases, we may have to, like operate on the patients, especially if this trauma causing serious problem like bleeding inside the eye, or causing retinal detachment, or causing penetrating injury like causing cuts in one of the coats of the eye. In that case, he will need surgical treatment with suturing of the cuts that happen in the eye.